My name is Al Amalados and I'm the Deputy Medical Director for Medical Education for Sussex Partnership NHS Foundation Trust. And on behalf of the Trust, I would like to welcome you to your new posts that you will be taking up with us. By way of introduction, we are a large mental health organisation. We provide services in West Sussex, East Sussex and Brighton and Hove, out of over 140 sites. We have about 100 junior doctors working with us, together with a similar number of consultants and associate specialists. Mental health is very important, regardless of which medical specialty you finish up in, because you will always come across people with psychiatric illness, and you need to be able to recognize that and at least have a discussion about how their problems can be managed.
Recently we expanded a lot the foundation posts in psychiatry because there is a national drive to have as much exposure to community posts and mental health posts for foundation doctors, because you can develop generic skills that are useful for any career, but also for foundation doctors to have experience of mental health. 1 in 5 of the population will develop mental health problems, so it will be almost impossible to do any career in medicine without coming across someone with a mental health problem.
My name's Dr. Stephen Allen. I'm a consultant psychiatrist here in Chichester. Chichester is one of those places that once you discover it, you wonder why you didn't come earlier, because it's a fabulous place to work and live. There's a good work-life balance in Chichester. You get a lot of training experience in different settings, working with small teams, so you get a lot of hands-on training, a lot of exposure to things that maybe at big teaching hospitals you maybe don't get quite the same exposure.
In this locality, we have a good diversity of services, so you might get exposed to inpatient services and then forensic inpatient unit, Chichester Centre. We have a very active crisis team that people can be exposed to. We have very active community teams. We also have camps, child and adolescent services, and we have old age, working age. So there is a variety of experience. The two main sites are Bognor Regis and Chichester. In Bognor Regis, this is almost the mental health hub for care homes for mental patients on a national level. So you might get a chance to visit some of those care homes, old age or adults. It's a very good experience to see the outcome of many people that has been suffering from mental illness. And I have to say, in the wonderful city of Chichester.
My name's Allegra and I'm a foundation doctor in my first year, working at the Harold Kidd at the moment, which is an older person's mental health unit. So the main sort of jobs I'm doing is sort of looking at the medical issues that come up on a day-to-day basis. It's fairly similar to being a GP. So there'll be sort of the odd cough and cold, various rashes, bits and pieces that the nurses come and ask me to have a look at during the day. So that's sort of my main activities in the morning. And then in the afternoon, the consultant who looks after that ward comes in and often we'll do a ward review. We have a discussion about each of the patients in turn. I'm expected to sort of have an up-to-date knowledge on their mental state and any medical problems that have come up during the week, and update the consultant on that. And that's sort of how the general day runs. And then obviously you get some odd bits and bobs from the ward round to do, so taking bloods, ECGs, those sorts of bits and pieces.
I'm Dr. Simon Chung. I'm one of the GP trainees, or GPST1. As a GP trainee in psychiatry in the community, I'm based here at Chapel Street Clinic. A typical week would be Monday we do a clinic based here in Chapel Street. Tuesday we would do home visits in the morning, and then in the afternoon go to the Bedale Centre, and that's where we would run a clinic together. Wednesdays we have our MDT meeting in the mornings, and then in the afternoon we have teaching, which is protected teaching for psychiatry, and in that we have case presentations, or we have a journal club as well. And then on Thursdays we cover Chichester itself, so then I'm based here in Chapel Street, and then Fridays are typically our admin day. But as a GP trainee, it's quite good to go out with all the other teams. So what I'll do is go out with the crisis team maybe, or I'll go out with one of the nurse practitioners here.
I'm Anna, I'm a psychiatry trainee. I'm in my 3rd year of psychiatry training here in Sussex Partnership. It's incredibly varied and it depends what job you're doing. So I've passed through various jobs which have all been different. At the moment I'm working on Oakland's ward, which is our sort of inpatient acute adult ward here. And my job will include things like discharge summaries and some of the sort of physical healthcare things, but also, you know, tribunal reports, attending tribunals, sitting with families, assessing patients when they first come into the ward. So a whole range of things really that give you a really big experience of psychiatry.
In the community, you have opportunity to be in clinics, general adult clinics, learning disability clinics, early intervention psychosis clinics. So you get an opportunity to learn a lot about the different subtypes of psychiatry. And because the places that you're working are smallish, it's a good experience. You're not competing with other people for time, for somebody's advice or time. The trainees on call will be seeing patients in the acute setting, so that's either at the A&E department at St Richard's or on the wards, and so they'll get an exposure to some frontline psychiatry, but with a lot of supervision. There's always a senior person, a senior nurse, or there's always a consultant to help give advice.
It's a bit unlike other specialties in that there often isn't a registrar on call, it's just you and a consultant, but the consultants here are so friendly and they sort of expect you to call. Then they'd much rather you ring and chat about a case than just you know, deal with it by yourself. So, because I know in other specialties there's always, you don't tend to leap straight to the consultant, so we always have to explain that at the beginning of this rotation to just use the consultants here because they're very good.
There's on-calls during the day and then obviously nights as well. You pick up a phone first thing in the morning and get a handover from whoever's done the night shift, for example, about anything that's outstanding. And then once everyone goes home after 5 o'clock, then you'd see all the new admissions or anything that was going on in the wards. That's probably the busiest time between 5 and 9 rather than during the day when mostly there's doctors on the wards.
In terms of nights, you're either covering Chichester as a whole or Worthing as a whole, and usually on nights you have the support of a specialist nurse practitioner, and they tend to cover A&E or little things that happen on the wards, and then you do the ward cover, and it's Chichester. You cover Oaklands and Howard Kid Unit and the Chichester Centre. Occasionally there can be times where there aren't nurse practitioners based in A&E, so that can get a bit busier, and then you are expected to sort of help out in A&E, or if they're snowed under, then yes, you'll cover A&E as well.
When you're on call, you're actually covering quite a large geographical area. It's not like you're just in one hospital. You cover St Richard's and then 3 different psychiatric sites, so it's really useful to have a car or a bike or something to help you get around. You are expected to be on site for your on-call, base yourself somewhere on the psychiatric site, and there is a sort of special on-call room with, overnight, there's a bed because I think they have to provide that.
The great thing about psychiatry is the rota is incredibly nice for a foundation year 1 doctor in that we don't do any on-calls. So we kindly got sent a rota, but our rota is 9 to 5, Monday to Friday. You still go to the normal foundation training on Tuesdays, and then on Wednesday afternoons there's the psychiatry training, which includes case presentation. Each team might present something interesting that they've come across, or they might find that it's a difficult case and they'll open it out to the floor and see what they make of it, which is a great learning opportunity for everyone in the room, really, not just us as GP trainees.
We try to get the best program for those trainees. We invite speakers. It's a very enriching experience, personally for me, for all of us as senior, and for the trainees.
And then after that we have Journal Club, where you just sort of get an article, break it down, and present something new that you might have learned in psychiatry, and that sort of helps to reinforce your learning as well?
The balance group is the group where you can share all your aspiration and frustration and feel supported with a professional. It's once a week, it's 1 hour, which will be before the Wednesday formal teaching, usually followed by a lunch.
On my current job, the major learning opportunities are sort of seeing a very wide range of psychiatric conditions and learning about sort of how to be with people, how to communicate, how to be with families. Whatever specialty you go into, there will always be psychiatric patients, and you need to learn this stuff and know about these sort of things.
I've really enjoyed sitting in and watching seniors do their consultations. I've also been to a couple of kind of home assessments and seen mental health factor assessments as well, whether that's at patients' homes or in A&E. And that's been really interesting to see as well.
For the core trainees, we have a dedicated MRC Psych course. So this is a very useful experience that's done centrally in Millview Hospital. Another experience is the audit fair, which is done yearly in November. And you will have the chance during your rotation to make even your own audit if you want, with the help of your supervisor, and to practice this audit cycle from a community base or even from an inpatient background.
Every junior doctor from the beginning of their job will know what their work schedule is and what their worked hours should be. If at any time they work in excess of those hours, then what they should do is to enter what's called an exception report, saying when they worked over, how much longer they worked over, and what was happening at the time, and then submit that. That will go to their educational supervisor, and a copy of it will also go to me as the guardian of safe working hours.
Nurses are more qualified than we are because they're specifically trained in mental health nursing and have often been in mental health for years, and they're the ones who really know the patient. So quite often I will need their help when seeing a patient. They will be with me, and likewise they always come to me for any of the medical things. We've got a really good pharmacists here actually I've got their numbers on my phone. Certainly all the inpatient wards we have dedicated pharmacists with mobile numbers.
You'll get emails about your on-calls and a fixed sort of rota pattern, and then within that you have to then swap your nights if you feel that you've got other plans on those days. But generally taking leave when you want to is quite flexible, as long as there's cover for your team.
My name's Edward Lepper. I work for the Mental Health Act Department in Sussex Partnership. My role is the Practice Development Officer for Mental Health Law, which means I'm a trainer for people on the Mental Health Act and the Mental Capacity Act. For junior doctors, we're going to do a training session around their responsibilities under the Mental Health Act.
With my clinical supervisor, I have a weekly meeting, so that's an hour, normally on a Tuesday afternoon, depending on what's going on. So that would be a time when we'd be able to discuss things in more detail and get feedback. During the early days of seeing patients on my own, which is where I am at the moment, then I'm discussing with a consultant after every patient I see, so getting immediate feedback on that.
We're very well aware that many of our trainees haven't done psychiatry or mental health at all. So we have several layers of induction. So we have trust induction, we have locality induction, and then we have local induction in our own teams. So there is plenty of time to learn, there is plenty of time to get to know people. In the first 2 or 3 weeks, you will be shadowing your consultant in just getting to know what's expected from you.
I would urge anybody to consider coming to work in Chichester. People who've been often stay around, and it's a great place if you're planning to set up, get a family, schooling, all that sort of thing.
Yeah, it's very well supported. I'm certainly enjoying it. You often have sort of apprehension, having come from a background of not doing much psychiatry in the past, but they're a lovely team here in Chapel Street and they're very welcoming, so yeah, I've had no problems fitting in.
So in a nutshell, welcome to Chichester and welcome to our postgraduate, and I hope that you enjoy every bit of it, and don't forget to visit all aspects of this wonderful town called Chichester. Thank you very much.
I do hope that your time with Sussex Partnership will be a profitable experience for you, and that you will learn as much as you possibly can in the 4 or 6 months that you are with us.